Hi, my name is Carly. I'm a third-year pharmacy student, and I'm going to be talking about GLP-1 medications used for weight loss. Here's a brief outline of some of the points that we'll be going over. The recommendations for weight management are based on body mass index and presence of comorbidities or other health conditions that are often related to weight. Here are some statistics about rates of overweight and obesity in the U.S. This chart shows how to calculate your body mass index based on height and weight and what BMI correlates to those two values. Here's a chart of the breakdown of how providers are guided to treat their patients that are overweight or obese based on their guidelines and whether they have those other health conditions that we talked about. So as you can see, you may start off with just lifestyle therapy, which is diet, exercise, things like that. And as you get into a higher BMI or more comorbidities, that's when different medications and potentially even surgery may come in. So the medications, what we're talking about today. There are three main GLP-1 medications that I'm going to talk about, including semaglutide, tirzepatide, and liraglutide. So as you can see, each of these have two different products under the generic name. These products, the Ozempic, Wegovy, Mounjaro, Zepbound, Victoza, and Saxenda, are all FDA-approved name brand products. As you can see, each generic has one that is indicated for diabetes, because that's what these drugs were originally made and studied for, and then another brand that is indicated specifically for weight loss. So the dosing of these medications, both semaglutide and tirzepatide, is a once weekly injection, whereas liraglutide is daily. So all of these are subcutaneous or into the skin injections, and all of these you start at a low dose and work your way up to a full dose just to prevent some of the side effects that may come. Safety concerns. What are the big things that if I were a patient, I would want to know about or at least be aware of? Now, the big three safety concerns. Pancreatitis, inflammation of the pancreas. So patients experiencing this may have upper stomach pain, nausea, and vomiting. Tumors, also known as a neoplasm, is an abnormal growth of cells. These often occur in the thyroid or the pancreas with these drugs. And then finally, gastroparesis, which is slow stomach emptying. Patients with this may experience nausea, vomiting, and bloating. I do want to note that virtually every drug has safety concerns that patients and providers should be aware of. Most of these are rare and unlikely, but should be considered and just made aware. On the next couple slides, I have some statistics that were pulled from the FDA Adverse Event Reporting System. This is where anybody can report any kind of side effect or event that happened linked to a drug. So as you can see, these are the three GLP-1 medications that we're talking about today, and this is a total amount of any case that was reported to the FDA. So as you can see, there's a little over 107,000 cases that have ever been reported to this system. About half of these cases have came from 2023 and 2024, likely due to the increase in prescribing. Here are all the pancreatitis cases that have been reported, which as you can see is just over 4,700 cases. And then any neoplasm or tumor case that was reported, there's been a total of 554. As for gastroparesis, based on this public dashboard, there has only been 11 case reports, but we know the symptoms are nausea, vomiting, bloating, which are common side effects of these drugs, so a patient may not necessarily know that it is gastroparesis that they're experiencing. We talked about the big things. What are the more common side effects that patients are more likely to experience? Here are a list of several things. The most common side effects, a lot of them have to do with stomach or GI things because the drugs does slow down stomach emptying, so you feel fuller for longer and are more satisfied. So it makes sense that you're going to have some stomach issues. These are more common whenever you're first starting or increasing your dose. Next, we have some monitoring for safety and efficacy. Is it working? So because these drugs were originally developed for diabetes, a risk of low blood sugar is there. So you may want to monitor that if you're experiencing anything like dizziness, lightheadedness, things like that. Heart rate, body weight. Are you losing weight? Is it working? And just some other things that we talked about there that patients should be aware to look out for. Duration of therapy. How long do you have to stay on these? So the short answer, probably long term, possibly even for life. There have been studies that showed that patients who continue to stay on this medication for a long period of time maintain their weight loss or even continue to lose weight, whereas patients who stopped taking the medication gained weight back. Cost. Here is a list of costs for the name branded products. It is possible that insurance will cover these medications. It just depends on individual patients, their insurance, things like that. But this would be the out-of-pocket cost for the name branded products. Also, these prices are per pen, which last about a week. There are some online platforms that write and dispense these GLP-1 medications, but a lot of these are actually compounded generics, not the FDA branded products like the Zepbound and Wegovy, things like that. So these are actually made from a third party. While they may be made with FDA approved ingredients, the actual process and final product is not FDA approved. So it's just something to be aware of to make sure you're getting these from a reputable source. Prices for these range about $200 to $500 per month, depending on the drug, the site, things like that. Risk versus benefit of these drugs. Here we have just an overall broad pro-con list. Any drug is going to have pros and cons, regardless of what it is. So these are just some big overarching themes for these drugs to take into consideration whenever you're trying to decide if one of these medications is right for you in your weight loss journey. I wanted to throw out some other recommendations if you come to the conclusion that a GLP-1 is not right for you. What's next? Obviously, the non-pharmacologic things like diet, exercise, that has to come regardless of what method you choose. There are other medications that are options for weight loss. These are oral, either capsules or tablets. They're often daily, once a day. So patients who don't want to do injections or shots, this may be another option for you. And finally, surgical options. So these are considered whenever BMI is greater than or equal to 40 or greater than or equal to 35 with a comorbidity or complication related to weight. Most of these are laparoscopic, so they're not invasive, so it definitely could be an option if that is something that your doctor wants to pursue with you and to have a conversation about. So you have all this information. What now? What are the takeaways? These medications, these GLP-1s, are super effective for weight loss and can be super beneficial for a lot of patients. There are risks of adverse events and side effects, but that goes with any drug. Just make sure to be aware of these, know what to look out for, things like that. If you do get compounded formulations of these products, make sure they're from reputable sources. There have been cases of events because the patient wasn't clear on dosing or how to administer that. So just make sure that everyone is on the same page and you know what's going on and feel confident. And lastly, these medications are a tool in a weight loss journey. You can't rely solely on them and expect to see long-term results. You have to have lifestyle changes with diet and exercise. I hope this gave you some more insight on these GLP-1 medications and made you feel more prepared on the conversations to come with your provider on deciding whether these are right for you.